During COVID-19, many girls engaged themselves in boys due to lack of pads. These girls, when they go to these boys, they were given money which they could go and buy these pants. After they buy these pants, they will not break this relationship. These boys would tell girls that they will make them pregnant so that they will not provide the pads for those 9 months.
During holiday, I was a victim of teenage pregnancy. After that, I dropped out of school, then I stayed at home for 1 year.
Sasa mimi hiyo wakati ilikuwa wakati wa COVID-19. Mimi sikuwa najua kama kubeba mimba ni laana. Niliona wasichana wengine wakiwa na watoto na mimi nikajipata niko mjamzito.
Korona imekuja, nimesikia uchungu, ni mtoto wangu alikuwa na mimba na ninatembea na yeye sana. Nikitembea na yeye nimetaka yule mwenye mimba ashikwe na sijaona akishikwa. Nimesikia uchungu, nimetembea sana, nimeenda kwa chief na kwa assistant chief. Na mimi sijaona mtu mmoja anisaidia. Ni mimi pekee.
The COVID-19 had so many challenges, especially with our girls, because we noted once they went for that break, which was long, some of them indulged themselves into immoral behavior. Some even became pregnant. Others were married. So it was a great challenge to our girls.
COVID-19 affected my girls, or rather girls in general, because one, they overstayed at home during that time. They met a lot of challenges. Many girls got married at a younger age, and the majority also became pregnant.
Yeah, in Homabay, COVID really affected our girls because you realize that during this time our girls got pregnant, others were defiled. We have a lot of cases that were reported of defilement cases, and again others dropped out of school because of going for child marriages.
Now this project is informed by the statistics last year in 2020, where they were reported increased teenage pregnancies in Machakos. Machakos had a score of approximately 4,000, and then Homabay had a score of approximately 6,000 teenage pregnancies affected by COVID-19.
For young women, some lost their jobs due to COVID, and it meant that economically their families were affected negatively in terms of provision for the family.
The challenges that I faced as a teen mother is that, like, I am a student, I can't balance taking care of child and reading. Sometimes if I came back at home, I can't manage to read and take care of the child, because sometimes if I start reading, the child is there, wants something, so I can't manage to get it, and also sometimes my mother can be sick and she can't manage to get some money for buying food or anything else for the baby. Even I am a student, so I have nowhere to get any money for buying clothes for the baby.
Majority of the cases maybe that I will mention later from Machakos are coming from very poor families, and COVID added to the poverty levels in such setups.
When the government announced children for going back to school, I was unable to go back to school because my mother doesn't have a fee, and she cannot balance buying food and looking for my school fee.
Sasa wakati ya kuzaa niliambiwa msichana ni mdogo, hawezi kuzaa mtoto vizuri, lazima nipeleke Thika aende akafanywe operation. Mimi nilitoka hapa nikampeleka, nikaenda huko, hata sikuwa na mahali ya kulala. Mimi nikataabika, nilikuwa nalala huko nje ya hospitali, nikamuongojea mpaka siku ikafika, nikapewa yeye, nikamsukuma nikamulete huku nyumbani.
The fact that we have cases of girls who are pregnant, and especially minors who are below 18, is a cause for alarm, because a child is losing his future by getting pregnant early.
Integrated Interventions for Adolescent Girls in COVID-19 project. It's a project implemented in Homabay and Machakos County, and the main aim of this project is to strengthen the adolescent girls agencies to learn and stay protected.
Our partnership as planned with the donor, who is Beiersdorf, or rather Nivea in this case, they have a corporate responsibility of care beyond the skin. You are using their products to do your skin, but then beyond that, do they have responsibility? That's why they want to support girls to speak out for themselves, to be able to exercise their rights, and to be able to be protected from SGBV.
Mimi nataka plani ikinisaidia niende nisome, nimalize, nipate ujuzi wangu ndio nitafutie mtoto chakula.
Ninataka nisaidie kwa huyu mtoto wangu, ni mimi mama yake, na nisaidiwe nishike haki ya mtoto huyu na nishike haki ya mtoto huyu mwingine, na munisaidie kwa masomo, asome mtoto wake, akiingia kwa shule yeye ainue mtoto wake pale nimewacha.
So in the next 2 years, I would look forward to maybe lots of sensitization and awareness creation to parents on positive parenting, to the young girls and to our young girls and boys, and maybe our young women, on sexual gender-based violence, how to mitigate, how to report, and how to ensure that the case is well managed up to the prosecution period, maybe when the perpetrator will be prosecuted.
Vile nataka hata tukifunga, nataka watusaidie watuite, hata watuite, watuongeleshe, watupe support.
I also request them to provide me with a solar lighting system so that I can manage to read and prepare for my examinations.
We look forward maybe to having some training to our Department of Health staff on proper documentation of P3 forms.
So at the end of the day, we want to see girls who are free from sexual and gender-based violence. They are accessing education, and also they are being protected, or rather their rights are being protected.